So today we have Paula in the chair, and what we're going to do is very exciting dentistry here. We're going to get rid of a denture for her, and we're going to make her a bridge. So what does that mean? So she has a denture here. I'm going to try to lift it out here. Can you take that up for me? She's better at it than me. There it is. Okay, so here's the denture here. So you can see two teeth with all this plastic that is against the roof of her mouth. Open wide for me, Paula. So all this area here is covered in the plastic just to support these two teeth. You can also see there's a posterior edge here where the denture ends. Another thing that you can actually see is that there's a difference in color of the palatal tissue. The roof of the mouth is called the palate. And you can see where the denture is sitting, you can see the tissue is actually more purplish reddish, and where it's not touching is more pinkish. So that's not really great because there's a lot of pressure in here. So if there's a lot of pressure here, it's kind of pushing the arteries and the veins. It's like squeezing them, so there's not as much blood flow through there. So there's not as much oxygen getting into this palatal tissue. The other problem that it is that, well, there's a few. The other one is speech. Her speech could be affected because her tongue has to ride over the roof of this. I'm sure if anybody took a piece of, let's say, some plastic, moldable plastic, put it to the roof of their mouth and held it in there, they're going to feel that their speech is going to feel funny. Also, it's uncomfortable. The other thing is taste. There's taste buds in the roof of the mouth here, and by covering up this area here, she has less taste. One thing we have to warn the patient about is that after they get the bridge, we make her a bridge, that when she drinks something hot, be careful because this has been covered for years and years, and so the hot fluid passes over the plastic and insulates it from the gum here. So now we have to tell them, be careful because you don't want to, burn yourself. So what is a bridge? A bridge goes from on the road goes from one side of the road to the other side over the river. So if this is the river flowing from front to back, the bridge is going to go from here to here. So what are we going to do? Well, we're going to do a cap on this tooth. We're going to do a cap on this tooth, and we're going to join two teeth in the middle together, and we're also going to join the teeth to this one and this one. So it'll be 1, 2, 3, 4 unit bridge. So it just doesn't happen like that. What we have to do is decrease the volume of both these teeth to a certain size and parameters. We're going to take a mold of that. We're going to send it to the lab. A week later, she's going to come back, and we're going to insert it, and we're going to have a throwing out party. We're going to throw. No, we're not going to throw this out. I'm just kidding. But we're going to get rid of this. Actually, what I do is I ask the patients if I can keep it. We're going to sterilize it, clean it up, and sterilize it, and we use it for examples for other patients. Also, another thing to notice that I started to get some crud in this denture here. Paula's a very clean person. I don't think she likes to have all this stuff here. So she's been wanting to do this dentistry for a little while, and now today's the day. So we'll see you a little later and show you the preps afterwards.